go ahead and share my screen.
Claire, how do you pronounce your last name?
Cudahy, but look, I've been called cuddly, whatever. It doesn't matter. I don't mind as long as it's not anything mean. I don't care. So, but it's Cudahy, and I'm your regional director of growth for AARP Medicare Supplement plans. If you're selling any of the additional states you see up on the screen, Georgia, Florida, Arkansas, Mississippi, Louisiana, those are my states as well. I always like to take a moment to introduce myself. You can see on the top left-hand corner, that's a family picture. I always include that one because it's the whole family, right? Because every now and then, if you're on the phone with me, you might hear a little bark in the background. That's just one of my little crazies saying hello. So that was my mom's birthday. We went down to the Keys, my mom, my brother, my aunt and uncle, my dad and I. So I'm a big animal lover. I have two dogs. One's named Bear. You might pick up on a theme. Lisa, don't hate me. Uh, that I do especially love elephants. I always say my house is like a Where's Waldo, but where's the elephant knickknack? But having the Southeast, I do think an important fact to bring up, and it's nice to finally be on a call where this is probably appreciated. You got to talk about who's your college football team, right? So even though I live in Miami, I did attend the University of Alabama. So roll tide. The last time they won the national championship, they were down here in Miami. So I actually attended that. It was a COVID, so you could see everybody 6 feet apart. So kind of a fun fact for me. And then last and definitely the most important picture up here, that's my Mimi. That picture was taken a very long time ago. And Mimi's now 100 years old, and she is my why. So I like to remind you all to keep your why front and center. I think this past AEP this year, it's been a lot of stress. I feel like when one thing happens, it all happens, right? So remember why you got into this, why you decided to help your Medicare consumers. I always want your members to be treated the way I'd want my Mimi to be treated. So just remember to keep your why front and center as well. So moving right along, we have a jam-packed agenda. So we'll go over why UHC, we'll go over our AARP Medicare Supplement plan offerings, underwriting, eligibility, and rating for our AARP Medicare Supplement plans. That's always everybody's favorite. And then we have the enrollment, client support, and your agent experience. Just want to make sure I can see everything clearly here. 1 second. Okay, so I'm not sure, is there a chat box or anything just in case there's questions? Let me see. Okay, I see it. Okay, perfect, got it. Just making sure
There
I
is,
got it.
Claire, and we'll monitor that for you as well.
Perfect. Okay, thanks. Very good. So moving right along, we have here the YUHC. And so starting off with our AARP Medicare Supplement Plan values, first off, our brand. We're the only Medicare Supplement Plan with that AARP name. So when you're selling our Medicare Supplement Plan, you're selling two very strong brand names. When you sell United Healthcare, you're not going to have to overcome objections like, who's United Healthcare? Are they going to play those games with their licenses and open and close them, with those rate spikes? We're a household name that you and your members can depend on. We're not going bankrupt. We're a Fortune 4 company. So you and your members can depend on United Healthcare. Now, we do have some discounts and services in the states of Alabama, so I will definitely go into more detail on that, along with our agent tools. But these last three, I think they go hand in hand. So satisfaction rate is 95%. Which in turn means a 10-year persistency rate, which is fantastic for the industry that we're in. And as your regional growth director, I'm here to give tidbits of information that I hear along the way. Well, there's a 94% renewal rate. What does that say to me? Enrolling into an AARP Medicare supplement plan is good for your book of business because you're not constantly reinventing that wheel every year. You're not constantly having to work on your book of business and getting them on a new plan. You can focus on new business because there's a 94% chance they're probably going to stay with the plan. So we are #1 in the nation. So we have just over 30% market share So that is nationwide, but specifically in Alabama, we have 17% of the market share, just over 28,000. So I know after this call, you guys are all gonna get me to that 30,000 enrolled, right? That's the goal. So Alabama, there's a lot of opportunity. Just over 68,000 individuals turning 65, and over 230,000 are already an AARP member. They do need to have that AARP membership. So that's one less sale you'll have to do with those 236,000. We have quite a few plans available in Alabama, the A, B, C, F, G, Select G, K, L, N, and Select N. Our billing cycle is June through May. So you'll see those rates usually change every year in June, and Alabama is community rated, but we're going to go into the discounts and everything that we have available here. So if you've never sold a Medicare supplement plan or you're pretty new to Medicare supplement, one of the most common questions I get from agents is, what does a Medicare supplement consumer even look like? I like to start out with the location of residence. We can definitely kind of check with the state of Alabama. Suburban is 54% of the population. We can definitely check that off with Alabama. Urban, definitely. We have some urban areas as well. That's 27% of the population are usually come from an urban area. And then lastly, rural, 19%. We definitely have that in Alabama as well. Makes a lot of sense because there are no networks. They can go anywhere that accepts original Medicare without a prior authorization or referral. So if the networks are kind of far or providers are far and few in between, maybe having a Medicare supplement plan makes a lot of sense for that consumer as well. Another box I kind of like to point out here is the activities and hobbies that they do more than average. They travel, they read, they walk and hike, and they go to the gym, they work out. Our Renew Active utilization is extremely high with Medicare supplement consumers. That's why nationwide, we kept the premium gyms for our Medicare supplement consumers with Renew Active. So Lifetime Fitness, there's lots of different smaller local, like the Osteo Strong I have here down in Florida. But if you look in Renew Active, you'll see and select the Medicare supplement premium network. You'll see that those are all available for your Medicare supplement consumers nationwide. And then probably a little different from your DSNP consumers, 65% are comfortable using technology and 93% regularly use a smartphone. So my advice, call them maybe 5 days after their effective date. Make sure they received their ID and their welcome packet. Maybe get them set up on the member portal because they're using it. And you can also get them set up with Renew Active, and I'll go into details a little bit later on how to do that. So the next follow-up question I get from what does a Medicare supplement consumer look like is, well, then how do I find them? And it's probably doing a lot of the same things you're already doing. So referrals, maybe financial planners, CPAs, community events, getting involved in some networking events like expos and trade shows. I can tell you my number one agent, that's all he does. He's always involved with the counties and the cities and their HR departments and going to their expo events for those retirees. Or teaching a Medicare 101 class. It's really about what works for you and maybe works in your area. Every area has something a little different, so it just depends on what works for you. But if Medicare 101 is what you would like to do, we do have a fantastic Medicare Made Clear presentation on the toolkit that you can use. So our AARP Medicare Supplement Plan offerings. First off, starting with the value of our Medicare supplement plans. They're plans that fit budgets, needs, and lifestyles. A lot of times there's this misconception about Medicare supplement plans that they're only for the extremely wealthy. Of course, they need to be able to afford their premium. I'm not going to take that away, and there is a premium. But we do have a variety of options with a variety of different premiums. And for those that actually make $50,000 or less, 42% of them do choose a Medicare supplement plan. Why is that? It's because unexpected medical costs could be detrimental for them. So instead of having that unexpected cost, same way they budget in their mortgage and their car payments, they also budget in their health premiums. And then I'll put these next two together. I think they make a lot of sense. Where to get healthcare and when to get healthcare. As I mentioned earlier, anywhere that accepts original Medicare has to accept the Medicare Supplement plan. So they can get as many second or third opinions as their heart desires. I showed you a picture of my mom's birthday when I first started this presentation. She is the prime example of a perfect person for a Medicare supplement plan. She's never had a health issue a day in her life. She works out every single day. However, her siblings have had cancer, so she's become a little bit of a hypochondriac. She doesn't say it's if her day comes, she says it's when her day comes. But she says when that day comes, even though we live here in South Florida, she wants the flexibility to be able to go to Sloan Kettering because that's who saved my uncle's life when he had his leukemia diagnosis. So for her, paying a monthly premium is peace of mind, knowing she has that flexibility. Maybe they want to be able to go to Mayo Clinic, MD Anderson, wherever their heart desires, they have the flexibility to do that. And then lastly, some of our Medicare consumers, they don't like change. So a Medicare supplement plan might be a good fit for somebody like that. As long as they pay their monthly premium, these plans are guaranteed renewable for life. These plans have been exactly the same since 2010. So just pay your premium and you don't have to worry about any changes. And then again, another very common question I get from you guys, which means that you're getting it from your consumers, is what's covered? Well, with Medicare supplement plans, we don't have things like EOC. So if you call me and ask me, hey, is this covered? Is that covered? Like, it's getting questions about specific DME things. It's like, I don't know about that brand or whatnot. Whatever Medicare covers, because they are primary, we have to cover. So a great way to find out if a specific procedure or whatever your consumer is asking about is covered is to go to www.medicare.gov/coverage. Just like a quick Google search, you put in what they're looking for. We have the example of acupuncture here on the screen. Select acupuncture, covers up to 12 visits in 90 days for chronic low back pain. Maybe you're wondering what exactly is the diagnosis of low back pain, and then you find out it's lasting longer than 12 weeks, etc. Now, again, some more tidbit of information that I've just heard from my time of being in the field is you can also download the app, and I highly recommend it. It's great to have on hand if you're sitting with a consumer or at a booth or event, whatever you may be doing, and they call and ask a question like this or come up to your table. You can have it, you can get it in the App Store or in the Google Play. The only caveat have heard to that is that our newer Android phones have not been able to find the Medicare What's Covered app in the Google Play Store. So if you have a brand new Google or Android phone, you might not find it, but I've heard the older ones and any Apple phone can find it. So some basic enrollment guides, you already heard me say they have to have an AARP membership. Now I do want to point out they have to have an AARP membership at the time of the effective date. So if anyone's having an issue with that, it only has to be at the time of the effective date. They do have to have an anticipated Part A and B date, must reside in the state, which for us is Alabama, and in Alabama, they do need to be 65 or older. So just a plan review of all the plans we offer here in Alabama. I won't read it to you, that's boring. You can read it, you can find it in either your producer handbook or your enrollment kit. Between those two booklets, you probably can answer 95% of the questions any consumer could ask you. But I always say memorization makes mistakes. So don't try to memorize, if you're trying to figure out which plan which plan covers what, just pull up the chart. These are standardized. As I mentioned, they've been exactly the same since 2010. Now, G is by far our most popular plan. The only thing it does not cover is the Medicare Part B deductible. N has now become our second most popular. I do want to point out you still can sell a plan F or C if your consumer was eligible for Medicare prior to 2020. So we do see quite a few of those F applications come in as well. But you have a variety of options. Again, K and L are still very popular for those that want the flexibility of no networks, no referrals, but maybe want to save a little bit on premiums. And I'm very fortunate because all of my states, and actually most of the nation, have all the wellness extras. So the big one, and the one I'll hone in on more, is Renew Active. That's the one I'm asked about the most. So I'll save that for the upcoming slides because we're going to talk a lot about it, but I don't want to just look over everything. We do have our AARP Staying Sharp, which are brain exercises. We have some vision, hearing, and dental discounts. We also have the AARP Smart Driver, which is another way that you can help save your consumer money. If they complete the course, there's a good chance that if they submit the certification to their car insurance, that they'll get a little discount on their car insurance. I do want to point out if they decide to let their AARP membership lapse or cancel, whatnot, they will not get the discount for that AARP Smart Driver. We do also have the 24/7 nurse line, which I think is an overlooked benefit. A lot of times we don't talk about this till it's necessary, but it's good that your members know about it ahead of time because it truly is 24/7. It could be 3 a.m., Christmas morning. Maybe they had a little bit too much to eat, a little too much to drink, and they're having some chest pains. They don't know, is this something that a Tums could take care of, or maybe they should go to the ER. Have a conversation with the nurse. That's something that they can discuss with them. They can even discuss medications. Maybe they really had too much to drink and they don't know what medication they took or how much of it. Talk to the nurse about that. But it doesn't even have to be about them. It can be anybody in the household. The grandkids are visiting. It's Christmas. They broke out in a rash. Call the nurse. Have a conversation with them about that. But again, I really, really want to stress that with Renew Active nationwide, including Alabama, we kept our premium gym location. So that is something that is a differentiator for us here at United Healthcare with our Medicare supplement plans. And again, our members really do utilize it. So Renew Active is actually much more than just a gym network. Not only do they get these great gym locations, and we have an extensive network, but we also have digital options as well. Maybe they don't have transportation, they share a car, they don't drive anymore, but they still want to be active. We have all levels available for them for just some some in the chair stretch exercises, all the way up to intense workouts. And do not knock our Medicare consumers. I know when I actually do go to the gym and I take my spinning classes, they kick my butt. So it's up to them. Maybe they don't like going to the gym like me. I'm kind of weird like that. I always am embarrassed and I feel like I'm in everybody's way. Whatever their preference is, they can go in person or digitally. But I think this left-hand side is very, very important. And another recommendation for you that I would give is make sure you're listening to key clues or asking key questions that are going to give you more information. During COVID, we all learned about how detrimental isolation can be and how it doesn't just affect mental health, it can eventually also affect their physical health. Well, for most of us, COVID went away and we're back to our normal social lives. But for a lot of seniors, that's not the case. They were isolated prior to COVID, during COVID, and post-COVID. So listen to things like, oh, my grandson went away. We used to play board games. Now he went to the University of Wisconsin and I miss playing those board games with him. Well, did you know Renew Active has a board game club in your area? Or maybe they're like my grandparents who used to love to go dancing, or the also popular pickleball. Whatever it may be, you can put in the zip code and see what's available in their area. Now, there are 3 ways to activate Renew Active. Unlike our MA partners, we don't have that U card. So for Renew to be active, you have to activate it first. So we discussed they can do it on the member portal, and I'll show you a screenshot of what that looks like. They could call member services. I would only recommend that if you're in a bind. I'd probably poo-poo that one otherwise. Or you could really give them the concierge benefit of doing it for them on your partner optumfitness.com, and I'll also show you a screenshot of what that looks like. Each member will get an individual confirmation code and it will start with the letter A. So that's something that you can do for them. This is what that website looks like. Again, it's just partneroptumfitness.com. You put in the information that's in red there and it will give you that individual code. Now we also have the Renew Active website. You're probably pretty familiar with this, especially if you've been selling our MA plans. So if you're wondering, hey, what gyms are in my area, just put in the zip code and make sure you select the Medicare Supplement Premium Gym Network as your in the drop down that you'll see for the network, and you'll find all the gyms in the area, and it'll also give you any necessary information, like if there's a wait list. I've heard Lifetime Fitness can get pretty pretty busy, or if there's a time frame that they can go, or only so many classes, any kind of information they may need, it's going to show it on the Renew Active website. So again, that's a public facing website, so you can see that even before you sign the member up, uhcrenewactive.com. And this is what their member portal looks like. So lots of great information on here. Not only can they view their ID card, you can access their gym code and get that set up for them. They can see their claims, lots of information for them to see on there. So get them on there, and they're more likely to play with it than a lot of our other types of consumers, because again, the utilization is very high. Now, underwriting, eligibility, and rating for AARP Medicare Supplement plans. This is the fun part. So why am I here in the middle of July? Because you can sell a Medicare Supplement plan all year long. We are not dependent on AEP, OEP. There is an open enrollment, but it's different from the Medicare Advantage OEP, or SEPs. We don't use SEPs for Medicare Supplement plans, although they are necessary for your PDPs. But strictly talking about Medicare Supplement plans today, that is not something that exists in the Medicare Supplement world. Now, there are 3 opportunities when you can enroll somebody, and I'm going to go over the differences between them, because we want to make sure we're using correct lingo so that things don't get misconstrued. So first off, in the prime time to enroll a consumer is open enrollment. I'll discuss what that means. It is based off of the individual, not the open enrollment period of January through March. Guarantee issue, certain rights that a consumer has to certain plans that they will also not have to go through underwriting. And then lastly, if they don't qualify for open enrollment or guarantee issue, they can go through underwriting at any time of the year. So starting off with open enrollment, as I mentioned, this is the prime time to enroll your consumers into our Medicare supplement plans. This is based off of that individual's Part B. So once they're 65 and they get their Part B, it will begin at the beginning of that month. So this example is June 1st, and it will go all the way through November 30th for them. Again, if they turn 65 prior to, if they receive Medicare prior to turning 65, they will get a second open enrollment that will last 6 months from when they turn 65. So why do I say that Medicare Supplement open enrollment is the prime time to enroll your consumers? Well, first off, they have the choice of all eligible plans. All the plans that we offer, we have to offer them to your consumers during open enrollment. There's no underwriting, and there's no pre-existing conditions that can apply. So I'm a visual person, so I like to give just an example. We have Bob here. Bob turned 65 June 15th, so his Part A and B started June 1st. Bob has through June 1st through November 30th to enroll into any Medicare supplement plan that he would like. That's his kind of free-for-all 6 months to do whatever he pleases. Now, if you have a consumer who, when they turned 64, was just super excited about getting their Medicare supplement plan, you can actually take that application up to 14 months in advance with us. We will accept a paper app 14 months in advance. I don't recommend that. First off, you're probably going to be quoting them incorrectly. Our rates do change every June, or that's our billing cycle, and they usually do change. So you want to make sure you're giving them an accurate rate, which probably comes out if it changes in June, end of March, beginning of April. So I would recommend 3 months in advance if they're aging in, which can be done on Jarvis Enroll. Jarvis Enroll will allow up to 3 months in advance. But Sales 101, never walk away from a sale. So if Bob is just super excited on his 64th birthday, you can take that application, but just keep those couple disclaimers in mind. Now we have guarantee issue, and I hear guarantee issue interchanged a lot with open enrollment and or SEP. I think it's interchanged with SEP because it refers to a set of consumer rights that provide consumers with access to certain insurance coverage based off of circumstances like loss of employer group coverage. And I'm going to go into all 6 guarantee issues that we have here in the state of Alabama. But I think that's why it's confused with SEP. So we want to take SEP out of our brains when we're talking Medicare supplement. We also don't want to interchange it with open enrollment because it is different. I hope you're catching on to the It guarantees them access into certain plans. So they're not necessarily guaranteed to go into all the plans that we offer. It will be based off of that circumstance, and I'll show you what that looks like as well. And of course, if you're getting your commission directly from United Healthcare, it could be a different commission as well. So if you have, for example, somebody that just got Part B because they just lost their employer group coverage, we definitely want it to be that open enrollment application because it's going to benefit everybody. But the similarity is that they cannot be denied based off of their health status. There's no pre-existing conditions or anything like that when it comes to a guarantee issue. So in your producer handbook, there is this beautiful chart that goes over all 6 of our guarantee issues. Now, number 1 is definitely the most common. We hear this one all the time. An applicant has lost or learns they are going to lose or drops employer coverage. But you're going to pay attention here. You're probably thinking, why is it pointing out the different effective dates? We all know they can't get F or C after 2020. Well, it's more than that. Again, we don't have to offer all plans that we sell. If you take a look here they were eligible for Medicare prior to 2020, there's no G that's available. So please make sure that you're paying attention to the chart. You cannot mess up if you have this chart open while you're going through the application. The other thing is it will tell you all the documentation that's needed, which can be submitted on Jarvis. So you don't want your apps pending for no reason. You can make sure you are able to get that documentation. So loss of employer group coverage is very common. I don't think there's probably many questions on that. But number 2 was extremely common this past AEP. An applicant is enrolled in a Medicare Advantage, MA, other Medicare Managed Care program of all-inclusive care, which is PACE, or for the elderly PACE, or a Medicare Select plan, and that plan either stops coverage in the area or the plan sends notice it will stop coverage in the area. We saw a lot of this last AEP, so that is a guarantee issue. What is also a guarantee issue is if someone's on a Medicare Advantage plan or any of those other plans, but most commonly Medicare Advantage, and they move out of that MA service area. So if they move from Georgia to Alabama or even just different counties that are not in the same service area, that is a guarantee issue. And again, you have to follow the chart to see which plans are available for that circumstance based off their Medicare Advantage, their Medicare eligibility. And again, it will tell you all the documentation that's needed. Now, number 3 and number 4 are not that common, so I'll just read it to you so you have it in the back of your mind, but you can always reference it in the producer handbook if you need a refresher. But these are the only 2 that would give somebody a guarantee issue if they had just a Medicare supplement plan. So an applicant is enrolled in an MA, other Medicare Managed Care, PACE, or Medicare Supplement, including Select, and it violates the insurance contract. For example, being they were misrepresented in marketing to the applicant. Again, follow the chart, can't mess up. Number 4, applicant is enrolled in a Medicare supplement plan, including Select, and it's involuntarily termed. Most commonly, we'll hear that because of bankruptcy. Follow the chart, can't mess up. Now, number 5 and number 6, I do get a lot of questions on. So number 5 is the applicant dropped the Medicare supplement coverage to enroll for the first time in an MA or other Medicare Managed Care, PACE, or Select plan and drop that plan within 12 months. Every now and then I get questions about the length that they have. They have 12 months. So let's say at 65, they enrolled into a Medicare supplement plan. But at 70, they're really interested in our MA plans. They want to give it a try. And they do so. They have up to 12 months to come back without underwriting. It does have to be the same exact plan that they were previously on. So same carrier, same plan. The only time they would be able to go into a different plan is if that previous plan is no longer available. Let's say they were on the old school J. Well, that J we no longer sell. So then you would follow the chart and you can see which plans they are eligible for based off of their Medicare effective date. And again, what documentation is needed. Now, number 6 is kind of the exact opposite of that. So I think there's a lot of confusion between the 2. So when somebody first enrolls into Medicare Part A at age 65, the applicant enrolled in an MA or PACE plan at the same time and dropped that plan within 12 months. I cannot stress this enough. The Medicare Part A and the Medicare Advantage date must match, which also in turn then, as we know, means the Medicare Part B date matches. So let's go back to our example, Bob, that we had a couple slides ago. Bob's Medicare Part A and B started June 1st. So if his Medicare Advantage plan starts June 1st, he has the 12-month guarantee issue. But let's say Bob got a little lazy. His Part A and B start June 1st, but he uses IEP for July 1st. Now he is no longer eligible for that guarantee issue. Or if Bob had a delayed Part B. So A was June 1st, but B ends up being August 1st even. Well, that means his Medicare Advantage is August 1st, right? Or after. And he cannot use this guarantee issue. So you must make sure that all those dates match. That's one of the most common reasons why I see that this application does not go through. So as I mentioned, you can take an application at any time of the year. So if they don't qualify for open enrollment or they don't qualify for a guarantee issue, we can go through underwriting. Now we do use underwriting for two reasons. We, first of all, will determine the eligibility, and we will also use it to set the rates. We do have a higher level 2 rate if maybe they have some health issues, but they're able to ultimately pass. Now, again, another recommendation. You get a consumer comes to you, they're on maybe a different plan, XYZ Medicare Supplement plan. They're 70. They've been on it since 65. No significant changes that would cause a guarantee issue. They've had Part B for 5 years. You want to make sure that you're going through the underwriting questions at the beginning of your presentation. Don't waste your time. Don't waste their time. If they're coming, they say, my neighbor has AARP Medicare Supplement Plan G. That's all I want. I want that Renew Active. Let's go to the enrollment kit right away and let's take a look at the health questions. They are all listed there. Section 6 will be your knockout questions. So if they're saying yes to any of those questions, pivot. We have fantastic Medicare Advantage plans that maybe would be a better fit for them. If they answer yes to any Section 7 questions, well, they're probably going to have a higher rate. So make sure you go through that and you can tell them what's about to happen. If they answer no or not sure to any of those questions, go ahead, submit the application. But if they answer yes, time to pivot. So Alabama is community and area rated. So all insured members in the same rating class in the same area pay that same rate, excluding our discounts, which I'm about to go into, because Alabama's discounts are a little bit complicated. We also have the gender rating, so rates for new sales based on applicants' biological sex. And then we also have tobacco rating. Now the tobacco is strictly about tobacco, at least for the rating, right? So we're specifically looking for cigarettes, cigars, dip. The one that I get a lot of questions on is vapes. I truly do not know what is in a vape. We're not looking for nicotine. We're not looking for marijuana when it comes to rating. So if they're asking you, does my vape count? The question to ask them is, well, does it have tobacco? I don't know. Their answer will answer the rating question. So going into our discounts, we have quite a few available in Alabama. So you're very, very lucky to have this. So we do have our enrollment discount, which is up to 39%. And I'm going to go into a deep dive on that. But we also have the multi-insured, which is up to 10%, which is if two consumers are in the same household on the same AARP AARP membership number, they will each get that 10%. So doesn't have to be doesn't have to be spouses. It could be siblings. It could be friends, as long as they live in the same household and same AARP number. But they don't even have to be on the same plan. One could be on G, one could be on N. That's okay, as long as they're both enrolled on our plan and they have that same AARP membership number and the same household. Then the last two is an or situation. They can either get electronics fund transfer by $2 off each month by using the EFT option, or, which you'll see that you can't do both, you can pay annually. Again, our billing cycle starts in June, so if they decide to pay their whole year in June, they will get a $24 discount. Let's say they enrolled for March, obviously they cannot pay annually, so maybe they do that EFT for a couple months, and then come June, they can go ahead and pay annually if that's how they would like to do that. But again, it will equal up to the same amount, whether it's $2 a month or just $24 in total. So just another slide for you to get a visual. Again, I'm visual, so it helps me. So all the options that they could have. So the enrollment, it could be up to 39%. Multi-insured is 10% per consumer, and then the $2 per month or the $24. So let's take a look at that enrollment discount. It is a 16-year program, and it's kind of a little thank you for those who choose to be loyal to us starting at age 65 through 68. If they enroll at these anywhere between 65 and 68, they will get a 39% discount. Starting at age 69, the enrollment discount will decrease by 3% each year on the anniversary date until it levels off at age 81. This is very important to pay attention to because we only change our rates once a year. Our billing cycle is always June through May. But sometimes in Alabama, you guys will get calls from your consumer saying, why is my rate changing twice in 1 year? It's changing for them specifically, but it's not a rate increase per se. It's their discount weaning down on their anniversary date. So that's why if they're calling you saying, I got a rate increase on my anniversary date, it's not a rate increase, it's the discount weaning down. But no math needs to be done. I did attend the University of Alabama, but I struggled with math. So I'm very glad that you don't have to do this and I don't have to figure it out. So 81 is our standard rate. So if you want to see what the rate would be for the whole community, you would look down here. But let's say we're looking at, I'm pointing at my screen and not your screen. So you would look down here at age 81 at the 224. And please don't hold these rates. These are just examples. So let's say they want Plan G. They're 65 years old. You see here, we're taking it out. And that is exact what the rate will be with that 39% discount. No math needs to be done. It's already in the enrollment kit for you. So 39% discount of $224.25 is $136.79. And then, of course, you'll see down below what the level 2 rates are. So this is if they went through underwriting and they got that a little bit higher rate, this is what they will get. So if there's 2 people in the household, I just used easy math. Don't hold me to these numbers. It could be different for whatever consumer you're using or have, but these are the kind of discounts that they could get. So, oops, sorry, is there a question? Oh, okay. If there is, let me know. So if they have the standard rate, we'll say it's $200 per person. And then they get that 39% discount. That means it's going to take off $78. And then we also take the 10% off from the standard rate. So in this circumstance, $20. So the total for one person could be, in this example, $102. So if you have 2 people in the same household, their now combined premium is $204, and they could even possibly get the $4 off if they decide to pay with EFT as well. So you can see how it can almost eliminate the other person. And it's a huge savings that you have available here in Alabama. We're very fortunate to have this. This discount program isn't available in all our states. It's like if you're selling in Georgia or Florida, not available. So enrollment, I could not preach this any more. Please, please, please use Jarvis Enroll. I have quite a few reasons why. One, I have a fantastic team behind me. Some of you maybe have met my account manager, Karen Goodmote. She is phenomenal, and she works so hard to make sure that everything goes right operationally. So when you send an escalation, she works with us. And our IT team is also fantastic. I don't work with the Postal Service, and a fax is very old technology. So if you are using a paper app and mailing it in and it gets lost, there's nothing I can do there. Fax, there's just nothing I can do there. But what I can tell you is Karen, myself, and the IT team, will work so hard to find your application or fix whatever maybe happened. We'll do our best. So help us help you. I had an agent that he used a paper app and he forgot to put his writing ID. Guess what happened for that agent? He didn't realize it for a little while, and it passed the leeway, and he never got paid on that consumer, and there was nothing we could do to help him. And it eliminates a lot of human error. We are all humans. We all make mistakes, especially as we get closer to AEP and we're just fatigued. It's really easy to miss a small little box, and now your application is pending. Your consumer is wondering what's going on, all because you forgot to check a box. Don't do that. Jarvis Enroll won't allow you to move forward if you miss a box. So it eliminates a lot of that human error. But something that really sets us apart that I haven't heard from our competitors is we have in real-time underwriting now. So we have come up with our Express Security Code, which is one of our signature options. It can be used in person or remote. They will send the consumer an email with 6 numbers. The consumer will tell you those numbers, and you will use that as their signature. That way they only have that one signage one time, and it's also a safer option. But on top of that, you get the in real time underwriting. So most decisions are rendered in 2 minutes or less. Think about the time that saves you. Time is money. Now you don't have to do a follow-up appointment. You don't have to waste gas and time. And your consumer, more importantly, doesn't have to worry what type of insurance they're going to have for 10 to 14 days. You will know in 2 minutes whether you're doing a PDP application or pivot and going to our MA plans, right? So you can get it all taken care of in one sitting. But again, consumers don't need to be worrying about that. But if we can't give you the decision within 2 minutes, maybe we really have some questions, they will give you a direct phone number to an underwriter to have a conversation with. But more than just that, we have in real-time premium rates. So Alabama could be a little confusing with our enrollment discounts. Like I said, I am not good at math. Do not ask me for math help. I'll try to help you with anything else that I can, but maybe not math. You don't want my help with math. So it's all calculated there. It's going to calculate not only the enrollment discount, but the multi-insured and the EFT, all those good things. It's going to show all plans that are available. You can send them the enrollment kit because we do have to send the enrollment kit prior to enrollment. Another big one is the AARP membership. So the only time I really see an open enrollment application penned is because they tell the consumer, or the consumer tells you, the agent, that they have an AARP membership and maybe it's lapsed, or it just isn't active, or they gave you the wrong number. So go onto that website. You can either sign them up if they don't already have AARP, but if they do have it, or if they sign up and get it, just copy and paste the number. Don't depend on anybody else. Just get it straight from there. So please, 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 if I can't say it loud enough, please use Jarvis Enroll. Just so you get a little picture here of what your member will receive once they become effective or once they sign up. They'll, of course, get their ID card. There's their myaarpmedicare.com for their member website. And you can see all of this on Jarvis by going to Knowledge Center, Member Communications, Medicare Supplement. So they will start to get some emails, some welcome videos, e-news, and some benefits and health resources as well. So for your support, actually, just a fun fact about me, I actually started my Medicare career here at United Healthcare, and then I took a break and went over to a different carrier for a very hot minute, less than a year and a half. And in that short amount of time, the amount of improvements that they had made on Jarvis blew my mind. So if you're not utilizing Jarvis, please play around with it. In your book of business on Jarvis, there's the letter history. So we cannot put every single letter on there because of maybe like it's an underwriting application, and they have a sensitive condition, HIPAA, we can't put that on there. But a lot of the letters are available in your book of business. Why did we do this? It's to be fully transparent with you. Who do the members call when they get a letter? It's not us most of the time. They call you. And you were left scrambling. Oh, what do I do? I don't know what you're talking about. Let me call PhD. Let me catch up. Let me call, my manager. I have no idea what you're talking about. Most letters are now available in your book of business, like when they get their annual rates, their premium bills, all that will be available for 90 days in your book of business. So you can reference that. And then I'm going to show you some examples of what you can do in your book of business for servicing and for your applications as well. So as far as your book of business, there are 18 services that you can do for your members. These are just some highlights, but there are additional ones as well. Change the address. If they're moving, you can do that. Terminate a plan. I hope you don't want to, but you can. They want to start getting that $2 discount for EFT. You can go ahead and change and add that phone number, correct how information is displaying, or change Medicare information. The one that's not up here that I think is probably one of the most utilized is the plan change. You don't have to use that Form PC or call into member services. Just submit the plan change in your book of business. It'll email them to sign, and boom, it's done for the next date, so the next first. Same thing with your applications, your pending applications. There are 16 services that you can do for them. These are just some highlights. Missing guarantee issue documents. So we went over the chart. You're probably not going to have those letters on hand right away or whatnot. Submit them in your Jarvis. Withdraw the pending application. Again, hope you don't want to or need to, but you can. Change the requested effective date. So common. I was going to retire in July. Now I'm retiring in August. No need for a new application. You can just change it on Jarvis. Same thing with that plan selection. No need for a new application. They're in between G and N. Oh, they changed their mind. Go ahead, update that. Missing replacement notice or missing Part A or B effective dates. We know that Medicare is super quick with their getting their cards out and everything like that. But if they don't get it in time, and you kind of thought it was going to be a Part B date or July 1st, and it actually ends up being August 1st, just update it on Jarvis, no problem. So you probably receive a lot of emails from us, some educational articles. Mine, I think, went out last March or whatnot about MyWide. You get the What's Up with MedSup promotional videos, training invites. But if you're only going to read one thing, please just read the Jarvis wrap. It's going to have MA MedSup information. It's about a 2-minute read. Can link to the training. So I get it. You guys are brokers. You get overwhelmed with emails from not only us, but other carriers as well. Again, if you're only going to read one, do the Jarvis wrap. We also have additional trainings. So lots you can learn about Jarvis Enroll Wellness Extras, anything that you're looking for. And if you're licensed in other states, most of the surrounding states, or except Tennessee, I have. So you can use this QR code to join a 101 course like this for any of your other states, because every state is slightly different. Remember, Medicare Supplement is regulated by the state. But I also encourage you to join a 101 once a year, always, for all the states and you're licensed and appointed in, because slight things do change. So you want to make sure you're catching on to those. But we do have additional trainings for the rest of this month. Anything that in regards to Alabama, we have coming up today. Our national trainer will do just for my 6 states, agent tools and resources on, and we always change the topic for that. And she's doing Learning Lab this month. Next month hasn't been posted yet, but it will be on Jarvis Enroll. Again, just for my 6 states. So it's a more intimate group if you feel more comfortable asking questions. And then I will also be doing this course all over again tomorrow, but including Louisiana. I do Alabama and Louisiana together because they're very, very similar. So if you want to hear this again, or you're licensed in Alabama, or in Louisiana and want to hear about it, tomorrow, 2 o'clock or 1 o'clock your time, I will be doing that. And Learning Lab, hopefully you're familiar with it. I won't steal Wendy's thunder if you're not. Go ahead and sign up for that course today at 1 o'clock. But there's lots of great things. If you're not familiar with it, please get so, because that's where you do your certifications. So on Jarvis, if you need to access it, it actually will pop up right now because it is certification time. But you can go to Knowledge Center, Agent Training, and then go to Learning Lab. Lots of awesome things there besides just certifications. You can find job aids, demos, e-learnings, whatever you're looking for is available on Learning Lab. Since I see we have a few minutes, I will also show you where to get your producer handbook and your enrollment kit, just because those 2 things really, I truly believe that you could answer almost any question that could come your way from the 2 documents. So with anything individual, Medicare, whether it's MA, MedSup, PDP, and even our IFP team uses Jarvis. So this is always your starting point for anything with us. And you'll go to Sales Tools, Sales Materials, and then go to Sales Material Portal. If you're more of an MA seller, this website's very familiar to you. So it's all the same spot. The big difference between our MA partners and us for this website is that, remember, Medicare Supplement is regulated by the state, not county service areas. So if you put in a county, you will no longer see Medicare Supplement documents. The only other filter when looking for Medicare Supplement I recommend to put in is 2025 MedSup. So first off, we have our enrollment kit. I recommend downloading it so you can have it on hand at any time. You can open it up. Open. Come on. Let's try this again. Open. Okay. And then all I'm doing on my keyboard is hitting Control F for that search. And I'm going to put in keyword questions. We talked about the health questions. So that's a keyword. I'm just going to hit next till I get to what I'm looking for, which is down here. So I mentioned section 6. don't want to go too fast and make you dizzy, but section 6 is our knockout questions. Section 7 is our level 2 rate. So that's all you need to do is put in a quick keyword and you will find that. You can also, and I highly recommend ordering some paper copies. I think our consumers like to get this document. Add to cart, just like my favorite website, Amazon. I go to my cart and you can order it. I highly recommend personalizing. I started my career in our telesales department. I can't tell you how many people would call in saying they lost their broker's business card. I mean, if you haven't lost a business card, I'm impressed with your organizational skills, but it's a lot harder to lose a 148-page booklet than it is to lose a business card. So put in your information. It will take a couple days longer to get to you, but it's so worth it. And all you have to do is put in your information, confirm, and proceed to checkout. I won't do it because I want to give you these booklets rather than having my information on it. We want your information, but very simple. All you need to do is proceed to checkout. The other document, and again, this one is your Bible, is the producer handbook. Really no need to order a paper copy. It can be updated as often. Last year it was about every quarter. It's always something very small detail, but you can see it was updated in January. I would check again maybe in a couple months to make sure that you got the most up to date. And again, the easiest way to do it is that Control F, put in a keyword, guarantee, and you want to learn about guarantee issue. There's the chart we went over earlier. So between those two documents, you have a lot of resources at your fingertips. Our agent toolkit, please utilize it. I mentioned our Medicare Made Clear presentation is on there. So much is there. We could have a whole other training on it, but the agents that utilize it actually sell 3 times more than those that do not. Everything that is on there is CMS compliant and and United Healthcare compliant. And lastly, I don't want to leave you without a little incentive, and my goal here is to get all of you to be elite agents. So again, if you're earning commission directly from United Healthcare, you can become an elite agent and earn a cash reward from United Healthcare. Now, this has to be on commission eligible, accepted, and paid sales of AARP Medicare Supplement plans and or our select plans. I don't really encourage select plans, but if you do, it could also add up during the annual production period of January through December. So this program provides cash on application count milestones that are reached by elite agents. So agents must be active, certified, contracted, licensed, appointed, and authorized to offer our AARP Medicare Supplement plans in the state in which that consumer resides for each application submitted. So agents will start to accumulate cash rewards once you reach that elite status. The minimum is 25 applications to become an elite agent. So not only do you get the cash, but all our authorized to offer agents get some marketing material on the toolkit. But once you become elite, you'll get additional marketing material. You'll get a listing on myuhcagent.com. You'll get your non-resident state appointment fees paid for, and you'll also get that cash reward. So a lot of incentives there as well. Lastly, I'll leave you with this. I gave you your resources on how to find a lot of information. Please use it. I know you guys have the Fowlers and they're amazing, but it always looks good to just have the information ready to go when you're with a consumer. If they ask a question, you look really prepared if you have it and you can pull it out of your computer rather than having to call or text people. I travel a lot. So whether I'm going to Alabama, Arkansas is all day, Minnesota to our headquarters, or driving in our alligator alley here in Florida with a rental car that I don't know how to use, I don't want to set false expectations and that you call me and I'm going to get immediately back to you. Odds are that's not likely. I will always get back to you, but it might not be right when you need it. And I want you to have the best possible experience that you can have. So our producer help desk is always available. You can call them, but I've heard better reviews about our PhD chat through Jarvis. It's a quicker wait time. And again, a better experience if you're sitting with a consumer. You can be chatting online and still talking with your consumer versus having to pull out that phone. We also are very fortunate to have the local managers that you have. They can always usually track me down, even if I'm in flight or wherever. So make sure you have their contact information as well. But with that, I will thank you. And we have 3 minutes. So any questions?
Thank you, Claire. And Ed has joined us now. So Ed is our manager that we can count on. Anytime I have a question, I always call Ed and he answers the phone. So Ed has joined us. Ed, if you want to say a few things, you're more than welcome to.
Well, simply to thank Claire for her expert presentation today, to apologize for my lack of technical expertise getting on this morning. I was challenged uh, and trying to be in two places at one time. All of that having been said, do call me if you have a question and I can filter it to Claire. Usually I can answer it right out of the handbook. Like she said, that's the Bible. And, you know, more often than not, I'll try to excerpt whatever's in the handbook and give you a cited quote from it because it is the Bible. But thank you, Claire, for coming on and doing this for us.
Thank you, Ed, and thank you everyone for joining, and thank you, Lisa, for putting this together.
Welcome. And those of you in South Alabama, you have Suzanne. So just want you to know that you've got great managers with United Healthcare. And also just wanted to point out too that the Med Subs, do not have a network. So just keep that in mind. They can go wherever, you can go wherever with the Med Sup as long as they accept Medicare. So that is huge. Michelle Hilton just asked if the presentation would be available to you. And yes, Heather gets that together for us. She is wonderful at that. And we will have that available to you to send out to everyone, even those of you who were not able to join us. So we will get that sent out today. But Claire, we can't thank you enough for being here and taking your time to share all of this with us and just get us up to date on United's Med Sup.
Well, thank you. I really appreciate the invite. You guys are great. So anything I can do to support you guys, please don't hesitate to reach out.
We'll do it.
Thank
So
you.
thanks everybody for joining us. Thanks Heather for getting all this together. We appreciate you. And we will see you soon next month. Bye guys.
Thank you.
Bye.